Welcome to Wellness Wednesday. You might have one at home, a husband or other man you love who has the classic dad bod. Is that a good thing? Sadly, according to a survey, men are uninformed about the common health issues that affect them, including the serious health risks associated with carrying those extra dad bod pounds. With us to explain more is Dr. Andrea Klemes, Chief Medical Officer of MDVIP. Good morning. Thanks for joining us today.
Good morning. Thanks for having me.
Absolutely. First of all, tell us what MDVIP is.
MDVIP is a national network of primary care physicians that practice personalized medicine. When they have more time to focus on wellness, prevention, and early detection, that time also affords them a deeper doctor-patient relationship, which makes you stay healthier.
You know, you surveyed some men just to quiz them on what they know about their health, and it sounds like most of them failed.
They did. Actually, 94% of men failed the MDVIP quiz.
Wow. Okay, so what are some of the big misconceptions that they have about their health?
I think one of the most striking was that 90% of men did not know that heart disease is the #1 cause of death. They thought it was cancer. Yet, 80% didn't know that a colonoscopy could help prevent colon cancer. And that was evidenced in the survey by knowing that men didn't have a lot of colonoscopies.
Those are two major things that, you know, prevention is key here. And if they just know these things and are informed about these things, they can really prevent some serious disease and some issues. So when we talk about prevention, I think dad bod comes to mind when we think about cardiovascular disease and so on. So what exactly is a dad bod, and what are those potential health issues?
Well, I always say think Will Ferrell or Jack Black as opposed to The Rock or Arnold Schwarzenegger, but it's a little bit extra fat around the middle, which you may say, well, it's only a little bit overweight, but that fat that's on the outside is also on the inside, and it surrounds your internal organs. And that makes you at much higher risk for heart disease, diabetes, and even certain cancers.
Yeah, it's that midsection, you know, that's where it's bad to have that extra weight in particular, but we joke about it, and it's cool and it's funny. So, you know, what can we do to encourage men to go to the doctor, because we know that they don't like to do that?
Well, that's true. We found that about 40% of men said they only go if it's urgent. So I think we need to change the paradigm. You know, men take care of their cars, right? They go for oil changes and rotate their tires. They take the car in when it's doing well and running well so that they can keep it that way. They need to think that way about their bodies. If they wait, it's going to be too late. So they have to work with a physician, like an MDVIP physician, who will do screenings and dive deeper to understand their risk for heart disease or diabetes or even cancer.
And, you know, there could just be some easy tweaks that we can make with our lifestyle, and that can make all the difference in terms of prevention. So what about a wife or, you know, even a daughter or something who is saying, I'm really concerned about my husband or my dad? What can women do to help nudge them a little bit?
Well, the good news is the MDVIP survey showed 80% of men said their spouse are very important to their health and an important influencer. So we have that. About half the men said that they would be motivated more if their wife was or spouse was motivated to also improve their health. It was funny because 40% said they know more about their spouse's health than their own. So women can do things like make them go to the doctor to get those screenings. Even if they see something, a red flag, like the husband's walking a little bit slower, or their spouse is short of breath on a short walk when they didn't used to be, or even see a suspicious mole. Those are all things that you can encourage your spouse to go to the doctor for.
That's a true partnership, you know, and we can be healthy together, we can do these things together, and then encourage one another if we see something that might be, you know, a little worrisome. So great advice this morning. Where can people go to get more information?
They can go to mdvip.com/menshealthiq, and they can go take the quiz.
See if you pass or fail. We've given you some, we've already given you a leg up here, guys. We've given you some of the answers. Doctor, thank you so much for joining us this morning.
Thank you for having me.
You bet. Take care. And thank you for making your day part of this Wednesday morning. Go freshen up your cup of coffee. We'll be right back.